The best thing about being a mental health nurse is that you develop your own emotional intelligence and communication skills to provide support in the patient's journey through their illness.
Working on a unit, we had a bad outcome on the unit, and unfortunately those things do happen at times in healthcare. And so at the time, you know, being young and, you know, like I've made reference previously, is like being this tough guy, hockey player, you know, you try to be tough and process things in your own way. And I realized, reflecting back now, I was almost promoting kind of within myself, the stigma that we're trying to break, is that frontline workers do experience kind of traumatic events, and, you know, we're trying to help people, and bad things can happen. And I think, looking back, I regret that I didn't seek help myself at the time. You know, I think I probably should have reached out for some counseling, some support, and I think I would have processed things differently. And, you know, I think I was lucky. I had a loving wife, and I had someone who knew what I was going through, and I didn't talk a lot to a lot of extended family or anything like that. But I think how I was processing it at the time, I can really reflect back now and say I wish I would have done things differently. But definitely now, I think it's very obvious. It's in the media. I think about frontline workers and the PTSD and traumas they have from their work, and I think now definitely I can look at it as a regret, but I think I would definitely manage things differently now. And also too, I think you can watch and see when others now, you realize what they're experiencing, and I can help promote and get people maybe the help they need too.
I'm very proud that I've been able to provide nursing support during the opioid crisis that we're facing. From providing the naloxone training when the take-home naloxone program first launched with Ottawa Public Health, to working in Ottawa's first supervised consumption site, and now working in the Rapid Access Addiction Medicine Clinic.
My greatest achievements in nursing is helping patients who comes in very ill, and able to understand them, able to be there and support them and give them the bright light at the end of the tunnel.